name is Christina Eboh. I'm a clinical pharmacist and I work at the Meads Medical Practice. I've been a pharmacist for over 10 years now. So when I qualified, I worked as a community pharmacist. So I was a pharmacy manager in a few community pharmacies. I've worked in pharmacy chains. So I've worked for Asda, I've worked for Superdrug. And then in 2016, I got the opportunity to work in primary care. So I moved to a GP surgery and I was part of the pilot scheme that were bringing in community pharmacists to train them up to be clinical pharmacists. Then I did my prescribing and I've worked in a GP practice since 2016. I think it was sort of coming out of university so young and, being a manager immediately in a community pharmacy and sort of getting to that point where I wanted to, diversify, increase my knowledge, go into a new sector, take on a new challenge. And then when that opportunity came for, when they were looking for practice pharmacists, it was a really good time at my career actually. So starting off in GP surgery, I did a lot of medication reviews. So when patients would come in, as patients are, by the way, could I ask this? By the way, could I ask that? And I was frustrated that I couldn't answer their queries because I just didn't have that knowledge. And I could see that patients were frustrated because it's hard for them to get an appointment. So you can understand when they finally do see a clinician, they want a ton of queries answered. So it motivated me to be like, actually, you know what? I can sort of increase my knowledge so that I'm able to help patients better. So that's what put me on the journey to be an ACP. So my role in general practice is, so first of all, I'm sort of like the diabetic lead. So I work with, so what I've done is I've trained up our HCAs to do foot checks, clinical observations for the patients, so the weights, the blood pressure, etc. They then go and see the nurse. So what I do, all the HbA1c bloods come to me. I comment on them just to assist the nurses because our nurses aren't prescribers. Just to say, the next step in the patient's clinical management plan. I do medication reviews, so structured medication reviews over the telephone, or it could be face-to-face. I do minor illness clinics, 2 clinics a week, where it's patient-facing and, patients come in, ear infections, minor illnesses really. And then my other role is admin, so I do a lot of the repeat prescription in the practice. I also handle queries, any queries from the patients, the GPs, any medication related queries, I handle all of those. Also, I support the practice with audits to see how we're prescribing and what we could do better. And also I liaise with our local community pharmacies just to see how we can improve our relationships and work better. So it's sort of an admin clinical role and I do a bit of everything, but it works. My role benefits the practice in one, more appointment times. So they have more appointments to offer to patients, especially a practice where we're nearly 13,000 patients in. We do need more appointments. So I'm able to see a wider variety of patients. It's not so limited, so it benefits the practice in that way. I think for the patients, number one, as a pharmacist, I get more time. So the GPs get 10 minutes. I can get anything between 20 to 30 minutes. So one, I have more time with the patients. I can develop more of a therapeutic relationship with them. They feel that they can talk to me longer. I've got more time for them. So patients leave feeling like they've been listened to, and it gives them a feeling like, somebody's looked at me holistically, not at just that one issue that I have to come and see the GP about, and anything else I need to book a separate appointment, but I've got more time to speak to the pharmacist and, discuss several issues, and her knowledge is broad enough to sort of help with the different queries that I'm presenting with. I think if you are an individual who has worked in your profession for a long time and you have a lot of experience, you are probably working at an ACP level anyway. Working autonomously, so making clinical decisions, looking at guidelines, but also being able to work outside of the guidelines, anything like that, a lot of you are doing it anyway without that sort of recognition. So I would totally recommend being an ACP because one, you know, broader knowledge, you get to interdisciplinary working, you meet different people, you know, you can strengthen your consultation skills, working with your nurses, GPs, etc. And also, I think it's that one step closer to if you wanted to be a consultant or, you know, you wanted to go into education. It's just sort of, you know, you're learning every day. And I think it's a good path for someone that wants to go to the next step of their career. In the next 2 to 3 years, I'm hoping to complete my ACP pathway. And then I'm hoping to sort of do some clinics with out of hours, urgent care, just to sort of diversify myself and lend myself out to a service that needs me. Because I mean, general practice is sort of like a 9 to 5, but, you know, evenings and weekends, you know, I believe that my skills could be used there. So that is something that I'm looking to do.